If you can help us to have a portrait of the current situation in a world level. Thank you very much.
So thank you for the question. That's a difficult question in terms of where we are in this evolution. So we are clearly many countries are in the difficult time right now in terms of dealing with this outbreak. Countries across Asia have had their first wave of infection, and many have been able to suppress the virus, have been able to bring the virus under control. We are seeing some countries which have seen a resurgence, namely in outbreaks and clusters of cases, either in expat dormitories or in major cities. And so we're learning from Asia. In Europe, we're seeing a stabilization in many countries. We're seeing a decline in others. And so that is welcomed news, but many countries have imposed very strict public health and social measures, or so-called lockdown measures, and are looking to ease those. So we cautiously need to see how, with the lifting of those measures, how that will impact the virus in terms of its ability to transmit further. We are seeing increases in a number of countries across the Americas, and we've covered a couple of those today already. But there are many countries which are seeing an increase, which is a worrying trend. We're seeing a number of countries in the Eastern Mediterranean region see a stabilization and a decline in their cases. And again, this is welcome news in terms of their ability to suppress this virus. But again, they have also imposed strict public health and social measures. So we need to watch with caution as those increase. And the situation in Africa, there are a number of countries that are still seeing low numbers of cases. And there are opportunities in Africa, in many countries across Africa, to be able to prevent the ability of this virus to take off. Again, it's a complex picture across the globe of where we are. I think it is very clear that we have a long way to go. The early seroepidemiologic investigations that are being conducted are indicating to us that a large proportion of the population remains susceptible, which means that the virus has the opportunity to infect more people. So it's important that that all countries remain vigilant and keep in place their workforce to detect the virus, to detect people who have the virus and care for them appropriately, to isolate them, to find and trace all contacts and quarantine those contacts, to ensure that the public is fully informed of the situation in each country and at the lowest administrative level, because it's important that the public go with us in this and really understand that we have a long way to go. And so we do see encouraging trends, and I think we need to celebrate those successes, but we need to remain humble. And we need to remain vigilant because this virus likes to find the cracks, and it will exploit those cracks and find every opportunity to take off if it can. So we must do everything that we can to prevent that from happening.
Can I just supplement? Marie's given an excellent overview. I just want to highlight one particular situation that we've become increasingly concerned with, and that is the rising number of cases in countries affected by fragility, conflict, and with high numbers of vulnerable populations, refugees or displaced populations. Over the last week, a number of weeks, we've seen worrying increases of disease in Haiti, in Somalia, in Sudan, in South Sudan, in Yemen, in Syria, in Afghanistan, in Sierra Leone, in the Central African Republic, and most recently investigating a serious cluster of respiratory disease in adults in Kano in northern Nigeria. We remain deeply concerned about the impact that this disease will have in communities who are already greatly underserved, have many underlying conditions, and it's a real concern for the humanitarian community. And I know Mark Lowcock, the Under-Secretary General for Humanitarian Affairs and the Director General, launched a humanitarian appeal a number of weeks ago now. But there's still a lot of work to do in countries. We need to get sustainable access to all populations in all countries. and we need to be able to deliver essential health services as well as COVID response. I think it's truly important that this happens, because these populations have already suffered too much. And the extra impact of COVID-19 at this point can be avoided if we rush to provide the extra support that's needed for these people who live on all sides of conflict. And as the Secretary-General has called for on a number of occasions, we need a de-escalation of conflict in these situations in order for a proper COVID-19 response to be mounted. No one on this planet will be safe until everyone is safe, and we cannot let this disease spread unchecked in these communities. It is neither the right thing to do, nor is it the smart thing to do.
And maybe we take last question before we finish here. Catherine Fiancan from France 24. Catherine?
Yes, do you hear me? Hello? Do you hear me?
Yes.
Okay, good afternoon.